Hi everybody, Dr. Shadi, Ireifej here, surgeon in true care for pets, Studio City, Los Angeles. This is Vet Talks. Let's pause for a minute. This is where we take a brief look at a topic of the week on an informal basis. And so we're going to talk about in this video is internships. And the reason for this video is because I've had several conversations with veterinary students who have expressed concerns that I also share as concerns regarding what they're being told in veterinary schools about veterinary internships. And so this video is going to be focused on what an internship is, what are the pros and cons of applying for an internship, and then what it is that the schools are saying currently that are of concern to me. So veterinary internships, also known as the general internship or the rotating internship, is usually a one-year program where a new graduate from a veterinary school who has received their Doctor of Veterinary Medicine degree can enter this one-year program where they go through a rather strenuous 1 year of training. And my focus is going to be on small animal internships, so dogs and cats primarily. I don't know if there's anything different on the side of large animal or mixed animal veterinary internships, but I'm going to focus on dogs and cats. And so the general internship or the rotating internship, you spend 1 year. It's a rigorous program. You go through different specialties. So the facility that you'll be interning at, either a private practice or an academic institution, will put you through multiple specialties. So they have multiple specialists there. That's how they get. That's how they are approved for the program, is they have to have a certain number of certain specialties there. So you'll go through and you'll spend X number of weeks on surgery, internal medicine, ophthalmology, dermatology, anesthesiology, whatever it is they can offer to you. And you'll spend the majority of your time performing services for the emergency department. So you'll be seeing mostly emergency cases, and then sprinkled throughout the year, you'll go through these other specialties. The program is set up such that you have X number of intern mates, so classmates basically. The number of intern mates depends on how big the program is. There are some that are very small, and there are some that are very large, and they occur all throughout the United States. You will spend overnights as well. You'll be working overnight shifts as well as day shifts. If you're on a specific specialty rotation, you'll follow with their schedule and work alongside the specialist. And then if you're not on a specialty rotation, you're on emergency, in which case you'll work whatever emergency shifts you have, whether it's daytime or overnight. The idea behind the internship is that it gives you gets your feet wet that carries over from the training you receive from veterinary school. And it is a program that although does not pay very well, will give you a level of experience that you could never receive from vet school, and you can never receive on your first year as a new graduate working in private practice. So most of us will compare 1 year of an internship to 5 years out in practice, and I think it's fairly accurate. I performed my general internship at Angel Animal Medical Center, Angel Memorial Animal Hospital in Boston from 2006-2007, and it's definitely one of the hardest years of my life in terms of veterinary medicine, but I could not be more thankful for the education that I received there. It was absolutely unparalleled, fantastic. A very, very hard year, very difficult, but you go into the programs knowing that you're not joining these programs for the money. You're joining them because of the experience you're going to receive that will get you ready either for private practice as a general practitioner, or if you're interested in specializing, it'll get you ready for a specialty internship or a residency after that. So and most people apply to the internships through the match program, although there are some that you can get outside the match as well. And so that's up to how it is. However it is that you want to apply for them, that's how you do it. So what are the pros and cons of the internship? The advantages of the internship are, like I said, you're going to get a huge wealth of experience in a very short time period. You're going to work alongside multiple specialists so you can see how they operate, what their thought process is, how it is they handle client communications, what are the cool things that the specialists are doing And then you'll spend a lot. And then the third benefit is you're going to spend a lot of time somewhat alone, seeing cases for the first time, learning how to handle them. But you also will know that you have the mentorship behind you from experienced doctors there that will help guide you through your first time seeing a specific case. And then over time, as they have more confidence in you and as you become more comfortable, you'll get more and more autonomy for these cases. There are some programs that have a lot more hand-holding than others. At Angel, we did not have a lot of hand-holding, which for me fits my personality type. I was very happy with that, but I knew if I needed help, I can acquire help literally at that moment with somebody who's more experienced, or if you're at an internship or in a shift where you don't have more experienced people, then your intern mates will be your go-to people to talk to get feedback on, get some help, because everybody's got different experiences, different confidence levels for specific diseases and specific cases. Or if no one's around, you're alone on an overnight and you need help, then there's always somebody on call for the internship program to help you out. So so I would say those are probably the three big advantages. The fourth advantage is if you are interested in doing a specialty like surgery, ophthalmology, cardiology, then you are required to have a general internship under your belt before you can apply for those programs. So you need that as the next step. It also will make you more appealing to general practitioner positions. So if you do a one-year internship, most GPs will like to see that you have a one-year internship under your belt, that you performed it successfully before they hire you. That way they know you've already gone through rigorous training and are familiar with the majority of emergency situations they're going to see as a general intern. So those are the benefits of the internship program. A lot more experience in a short period of time. You're going to be able to work alongside specialists, see how they operate. It will help you get a better job position. It's a requirement for specialization later on. And it's the best way to get your feet wet after a veterinary school programs complete. Veterinary schools are fantastic, but they cover a broad range of topics of all different species. Some of them will let you track what species you want, but that's usually the last 2 years, if they even let you track at all. So it's impossible to get 4 years worth. It's been possible to get to tackle all of veterinary medicine, all different species, every disease in 4 years. Learn the basics all the way to clinics. There's just no way to do that. And so the internship is your best bet to condense 1 year of getting past the foundational stuff that you got in veterinary school, be able to focus on the species that you want to focus on, and be able to allow yourself to get your feet wet with cases for the first time. Disadvantages: poor pay. It's not meant to be a moneymaker at all. You're going to be working really long hours. Somewhere between, depending on how strenuous it is, between 40 and 80 hours a week. You are going to be pushed to your limits in terms of workload, emotionally. It is a tough year, depending on the program, of course. You are going to spend time doing paperwork, especially when you're on a specialty rotation, following the specialist. You're not going to be able to do much on your own because the specialist will be performing a lot of the work. So you may be pushing more papers than you'd like, but that's kind of the give and take for following a specialist around, learning how they do things. Those are probably the disadvantages to it. And of course, it's another disadvantage. I guess I would say it's a gamble what program you receive. There are some programs that are better than others. I speak very highly of Angel, Memorial Animal Center in Memorial Animal Hospital in Boston. But they may have changed since then, I don't know. But it was a fantastic program, one of the top programs you can get into if you want a private practice, real world experience, and receiving your case experience for the first time. So those would be the disadvantages. Now, what's happening from what I've heard from veterinary students, that most academic institutions are discouraging veterinary students from joining internships. I think it's a huge mistake. They are saying that internships should be reserved for people who want to have residencies or want to go into specialization. There's a couple problems with that. First of all, most GPs now want to hire new grads that have received an internship, and it makes sense because they come in knowing a lot of the basic stuff is out of the way. They know how to do basic clinical things, and they can deal with a lot of emergencies, bad emergencies, on a 24-hour basis. So they want that experience for their new hires. Also, a lot of times you don't know if you want to specialize yet until you do an internship, because even though you've had a taste of specialty in the academic side, the internship is just another way of trying to tap into those different specialties. So how do you know what you want to specialize in? Do you really want to dedicate the next 2 to 4 years of your life for a rigorous residency program with a specialty that you're not really sure you're interested in? The one-year internship is a great way of experiencing that. So that's also good. It's good for your own education. You're going to leave vet school, depending on the vet school you go to, not knowing a lot of basic stuff because you're just physically impossible. You just can't. There's just no way, there's enough time to learn even the basics. And so the internship is going to give you that internal confidence to know that you can handle the majority of cases that walk through the door. So for me, hands down, if you can spare the 1 year of financial burden and you can deal with a hard 1 year with really bad shifts and a lot of stress with dealing with cases for the first time, then you do the internship. Hands down, you do it. Doesn't matter if you're interested in specializing or not. It's well worth it for your own education, to make you more marketable, and to help decide whether or not you want to specialize. So I think that what the schools are doing now, and it's not all schools, but I think what the schools are doing now, the ones who are guilty of this, need to dial it back and actually promote internships, actually push for their students to go into internships because they are well worth it. Well worth it. So there you have it. Those are the advantages and disadvantages of an internship. We help define what an internship is and kind of outline my concerns. Let me know comments below if you're a veterinary student that's experiencing this offhand. Please feel free to spread this video to other veterinary students, to your classmates, because I think that the academic institutions that are doing us a terrible injustice. We need more new grads in the field. We need them. Period. It's harder to find veterinarians to hire, and it's also very difficult to find veterinarians who have some experience under their belt. And if you're a new graduate, we want to take you in and mentor you, but it's really good to have that foundation. I can justify paying you more if you have experience already. I can also allow you to have some freedom and not feel like I have to babysit you. At the same time, I also know that the internship is not perfect, and so you are going to come out with different experiences compared to somebody else who graduated from an internship. And so at least I know where you're starting off as far as a strong foundation, then I can build you up from there and make you even more marketable to our clients. So definitely go for internships. I think it's the way to go, despite whether or not you're going to specialize. And let me know below if you have any, if you're experiencing this, or if you have any comments or questions, anything I have not touched upon regarding this exact topic. Let me know. This is Dr. Shadi Ireifej, Vet Talks. Let's pause for a minute, and we'll see you in the next video. Take care.